When I was about 17, I found out from a surgery, an oral surgery, that my adult tooth was embedded in my jawbone, and so it was never coming back, and I had a baby tooth. And it caused me many, many, many years of nightmares, thinking I was going to wake up in the morning and my tooth was going to be falling out, and it stressed me out tremendously.
When I met Melissa, she was referred over to me by her dentist because she had a baby tooth that was starting to get loose. Now, Melissa's done a great job of hanging on to this tooth for a long time, but it was time. It was starting to shake, it was starting to create some discomfort for her, and it was time to do a dental implant.
I did know about dental implants, and that was what I wanted to do with it. I didn't want any of those removable things, and I definitely didn't want to be toothless. So I knew that I wanted an implant. I didn't know how it was going to work because I'd never had anything like that.
Now, Melissa was very nervous about doing the dental implant. The consultation was more about kind of easing her nerves and getting her comfortable with the process. I talked to her about what's going to be involved with the removal of the baby tooth, cleaning out that area, and placing the dental implant in there.
Since I've had it done, I feel a great relief to have that replaced, and my baby tooth is not ever gonna fall out again because it's not there anymore. It just feels great to have it completely done, and it was a challenge, but we got it done.
The procedure went really smooth, it was painless for her, and we were even able to make a temporary tooth for her the same day, so she left with a tooth in her mouth so no one would know that she's missing the tooth. After a few months, the implant was able to heal to the jawbone, and she was able to get a final crown with her dentist. She now can chew and eat anything that she wants with this dental implant, and she's one of my happiest patients.